Hello, everyone, and welcome. Today, we're going to be looking at Chapter 10, all about healthcare, problems of physical and mental illness. Here is a chapter summary. The healthcare industry in the United States accounts for more than 17% of the gross domestic product, yet this is not translated into better life expectancy for everyone. As people live longer, there have been a corresponding increase in chronic diseases, some of which produce significant disabilities. HIV and AIDS has emerged as a presenting health problem both in the nation and globally. It should also be noted that HIV is the precursor to AIDS, and we don't really use the term AIDS anymore. There's a shift from AIDS to HIV 1, 2, and 3. Another social problem is mental illness. 1 in 4 adults in the United States suffers from a diagnosable mental disorder. People with mental illnesses are sometimes treated in mental hospitals, which are an example of a total institution. However, since the 1960s, treatment has become increasingly deinstitutionalized. Race, class, and gender play roles in mental disorders. The United States has been especially criticized because its costs are far higher than any other advanced nation. The 2010 Patient Protection and Affordable Care Act was implemented and will continue to be implemented and was designed to gradually bring about changes in how healthcare is delivered and funded. Private and public insurance programs serve some needs while creating some problems, including the rising number of uninsured people. Race, class, and gender influence healthcare. Functionalist, conflict, and interactionist offer different viewpoints on how healthcare problems might be resolved. After reading Chapter 10 and watching this video, you should be able to explain why healthcare is a social problem and describe how life expectancy data and infant mortality rates are key factors in determining the quality of healthcare in a nation. Distinguish between acute and chronic diseases and state the role that disability plays in rising healthcare costs. Using HIV as a case study for chronic illness, describe the effects that this disease has on the United States since the 1990s. Explain why mental illness is considered to be a social problem. Describe how deinstitutionalization was used as an effort to reduce the problem. Discuss various ways in which healthcare has been financed and identify how the Affordable Care Act is helpful in reducing healthcare costs while ensuring more Americans. Distinguish between Medicare and Medicaid as two forms of public health insurance. Explain how race, class, and gender are intertwined with other issues pertaining to healthcare in the United States. And finally, discuss functionalist, conflict, and symbolic interactionist perspectives on healthcare as a social problem and describe how this problem might be reduced using each theoretical approach. When we think about healthcare, healthcare is a social problem. What we see before us is an example of doctors and surgeons and their assistants who are performing an operation. According to the World Health Organization, health is a state of complete physical, mental, and social well-being. Although people in the United States pay far more for health services than people in other developed nations, our expenditures have not translated into better life expectancy. Life expectancy statistics may vary by sex and race. Overall, females live longer than males and whites live longer than blacks. In developed nations, life expectancy has increased as the infant mortality rate has decreased. Infant mortality is considerably higher in the United States than in many other developed nations. Perhaps the single most important cause today is the lack of prenatal care. It should also be noted that infant mortality rates are the number of deaths of infants under 1 year of age per 1,000 live births in a given year. Let's look at the differences between acute and chronic diseases and disability or differing abilities. Acute diseases are illnesses that strike suddenly and cause dramatic incapacitation and sometimes death. Chronic diseases are illnesses that are long-term or lifelong, that develop gradually or are present from birth. Among the most common sources of chronic disease and premature death are tobacco use, which increases mortality among both smokers and passive smokers, as well as alcohol abuse. According to some analysts, we have chronic diseases in our society because of the manufacture of illness, those who promote illness-causing behavior and social conditions. Some chronic diseases produce significant disabilities or differing abilities that significantly increase healthcare costs for individuals and for society. Approximately 54 million people in the United States have one or more physical or mental differing ability, and the number continues to increase for several reasons. One, with advancements, in medical technology, many people who formerly would have died from an accident or illness now survive, although with an impairment. Two, as more people live longer, they are more likely to experience chronic diseases that may have disabling consequences. And three, people born with serious differing abilities are more likely to survive infancy because of medical technology. However, less than 15% of people with a differing ability today were born with it. Accidents, disease, violence, and war account for most differing abilities in our country. So let's look at the HIV and AIDS crisis as a case study of what an epidemic is. By the early 1990s, AIDS had reached crisis proportions. More than 1 million Americans have HIV or AIDS today. AIDS is what's called the acquired immunodeficiency syndrome. HIV is called the human immunodeficiency virus. When we are examining HIV and AIDS, something to consider, especially since the early 1990s, is that more than 576,000 people have died from AIDS-related complications since the epidemic began. As of 2015, the CDC believed that about 40,000 people annually, on average, are diagnosed with HIV, and about 18,000, at least in 2015, were diagnosed with AIDS. While there's no cure for AIDS, there are anti-HIV medications that are available to help minimize the replication of the disease. However, HIV medications that are developed to combat HIV replications are expensive and often have many side effects. Now let's look at mental illness. Mental illness is a social problem because of the number of people it affects, the degree of difficulty that exists in defining and identifying various types of mental disorders, and the manner in which treatment is provided. A mental disorder is a condition that makes it difficult or impossible for a person to cope with everyday life. A mental illness is a condition that requires extensive treatment with medication, psychotherapy, and sometimes hospitalization. The most widely accepted classification of mental disorders is the American Psychiatric Association's Diagnostic and Statistics Manual of Mental Disorders 5, which came out in 2013. It's estimated that 1 in 4 adults in the United States suffers from a diagnosable mental disorder. The most common problems are anxiety disorder, mood disorders, impulse control disorders, and substance use disorders. The highest rates are for young adults ages 18 to 25, and rates for females are higher as well. Mental disorders produce direct costs at about $60 billion annually, and direct costs such as lost earnings of individuals, the costs associated with homelessness and incarceration, and other indirect costs that are difficult to document. People who seek professional help for mental illnesses are treated with medications or psychotherapy, which is believed to help patients understand the underlying reasons for their problem. Sometimes they're also given treatment on an outpatient basis or in a hospital psychiatric ward. According to sociologist Irving Goffman, mental hospitals are a classic example of a total institution. Total institution is a place where people are isolated from the rest of society for a period of time and come under the complete control of the officials who run the institution. Patients in mental hospitals are stripped of their individual identities by being required to wear institutional clothing and follow a strict regime of activities, meals, and sleeping hours. Development of psychoactive drugs made possible the deinstitutionalization movement of the 1960s. Originally devised as a solution for the problem of, quote, warehousing mentally ill patients in large prison-like mental hospitals, deinstitutionalization is now viewed as a problem by many social scientists. Critics argue that deinstitutionalization results in many mentally ill people ending up residing on the streets or in jails. Based on differences in mental disorders, these studies show that some of the factors are more important than others when considering who is impacted by mental health issues. Most studies have uncovered no significant differences in diagnosable mental illnesses between Black and white Americans. However, repeated personal encounters with racial hostility deeply affect the psychological well-being of most Blacks, regardless of education or social class. White Americans also pay a high cost for the prevalence of racism because it contradicts beliefs about the American dream and equality under the law. One factor that researchers generally agree is related to mental illness as related to social class. Analysts using the social stress framework to examine schizophrenia, the disorder most consistently linked to class, believe that stress associated with lower class leads to greater mental disorders. In contrast, analysts using the social drift framework argue that mental disorders cause people to drift downward in class position. Gender also appears to be a factor in mental illnesses. The rates of diagnosable depression is about twice as high for women as for men. This difference typically emerges in puberty and rises in adulthood as women and men live out their unequal adult statuses. Men have higher rates of disorders such as compulsive gambling or drinking, as well as maladaptive personality traits such as antisocial behavior. Analysts suggest that these differences between men and women are linked to gender role socialization that instills aggressiveness in men and learned helplessness in women. Studies also indicate that women in high-income, high-status jobs have higher levels of psychological well-being and fewer symptoms of mental disorders regardless of marital status. So this is a scene from the Silver Linings Playbook, and what's so interesting about this, the Silver Lining Playbook does a really great job talking about the realness of mental illness, because it approaches this from the understanding in looking at Bradley Cooper's character when we look at mania and the meltdowns that have a serious side, as well as having a diagnosis of bipolar disorder. You also see what happens after someone's released from a psychiatric hospital. And when you are looking at this, you also see obsession and delusions. And this gives an understanding of what not only an individual goes through when it comes to mental illnesses, but also what others may be going through when they are loving or caring for someone or in the world of someone who has a mental health issue. When we look at paying for healthcare in the United States, it's important for us to talk about a couple of different things. First, let's talk about the Affordable Care Act. In 2010, Congress passed the Patient Protection and Affordable Care Act. These are legislations that are implemented to change how healthcare was funded and delivered and to create some new insurance marketplace. So some medical analysts believe that this reform measure provided more cost controls, such as competitive insurance exchanges that are supposed to lower premiums and increase the quality of healthcare. But there are critics who say that the plan will bankrupt the nation while leaving many individuals without the healthcare services that they need. One of the main issues that has been brought up since its inception in 2010, not only under the Obama administration, but also under Trump's administration, is the fact that there are still many people who are under or uninsured because they can't pay for the costs within their state. There's aspects of this that have been cost analyzed out of range for many lower income families. In addition, there is also this notion of pre-existing conditions that has consistently been discussed, where the ACA would cover pre-existing conditions, but there are threats of it being taken away to an extent. At this time, the Affordable Care Act is more like a marketplace, and it allows you to get coverage at different cost tiers. You can choose between HMOs and PPOs to decide which is going to be best for you. When we look at healthcare organizations and rising costs, as well as unequal access, understand that these things contribute to the U.S. healthcare crisis. And the way in which they contribute to the US healthcare crisis is staggering. As we go through the rest of this chapter, you'll see that rising costs, a lack of competition in different states, and the amount of money that everyone has to pay, not only monthly for your insurance premiums, but then for different copays. And you have deductibles that you have to meet before insurance will cover everything 100%, is rising every year. It causes unequal access because some people cannot afford the monthly premium. Therefore, they go without insurance. It should be noted, though, that no hospital can refuse you care because of an inability to pay. Most hospital programs do have what is called charity care, where they will look at your income after you provide documentation, and then they will offer you payment programs and a sliding scale fee for the services that you've received. For many years, medical care in the United States has been provided on a fee-for-service basis, and these fees are higher than in other countries, especially when we look at private health insurance. Another problem in regard to overspending is the manner in which incentives from some insurance plans may encourage patients and doctors to overutilize expensive medical services and procedures. In the 1960s, third-party providers, which were public and private insurers, began picking up large portions of doctor and hospital bills for insured patients. Patients pay premiums into a fund from which doctors or hospitals are paid for each treatment the patient receives. This approach has contributed to medical inflation because doctors and hospitals receive more income when they increase medical services. Patients have no incentive to limit their visits to doctors or hospitals. In the 21st century, private health insurance premiums have continued to increase by between 6 and 7% annually. Health maintenance organizations, or HMOs, are one means of providing workers with healthcare coverage at a reasonable rate by keeping costs down. HMOs encourage patients to prevent illnesses before they occur by having adequate checkups, getting exercise, and eating nutritious meals. As long as patients use only the doctors and hospitals affiliated with their HMO, they pay no fees beyond their insurance premiums and/or once they meet their deductibles. Critics charge that some HMOs require physicians to withhold vital information from their patients if it could cost the HMO money to provide the needed procedure or hospitalization. When we look at that as an HMO, you'll find that this is a little bit different than a PPO. A preferred provider organization is a type of health plan that contracts with medical providers such as hospitals and doctors to create a network of participating providers. You pay less if you use providers that belong to that network. With both HMOs and PPOs, HMOs, you pick from a much smaller pool than a PPO. HMOs are also more each month for the access to doctors than an HMO. So again, PPOs are more expensive than HMOs each month. With an HMO, you typically have to get pre-authorization before getting certain procedures done, whereas with a PPO, you don't have that. When we think about HMOs and PPOs, one of the biggest takeaways is that with an HMO, there's definitely more restriction than a PPO, but a PPO, you pay more each month than you would an HMO. When we think about this, managed care has dictated who we can see, what we can have done, and will typically reward you with a lower monthly premium if you have less chronic illnesses or other diseases or sicknesses. Therefore, the push for HMOs and PPOs is preventing rather than reacting once you're sick. Another approach to controlling healthcare costs is managed care. This is a term that's used to refer to any system of cost containment that closely monitors and controls healthcare providers' decisions about what procedures, tests, and other services to perform on patients. In most managed care programs, patients designate a primary care physician, or PCP, from a list of participating doctors. When patients need medical services, they must first contact their primary care physician. If the specialist is needed, the primary care physician refers the patient to a specialist who participates in that program. Doctors must gain their approval before they perform certain procedures or admit a patient to the hospital or the insurance company can refuse to cover part of that cost. That's what's called a pre-authorization. These plans have unsuccessfully tried to curb the rapidly increasing costs of medical care. When we look at public health insurance, we look at Medicare, Medicaid, and the underinsured. So let's first look at Medicaid, and then we'll look at Medicare, and then we'll look at the uninsured. Medicaid, from its inception, is a federally funded healthcare assistance based on a two-tiered system, a medically entitled program for older people known as Medicare, and a medical welfare system for lower income individuals known as Medicaid. Some physicians abuse the system by operating Medicaid mills that charges excessive fees for unnecessary tests and treatments. Medicare and Medicaid account for about 25% of all federal spending. It'll be difficult to reduce these costs in the future due to the aging population, especially with baby boomers and the Affordable Care Act. But again, when we think about this, Medicare is for people who reach a certain age, typically retirement age, 65 years of age and over. Medicaid is for people who are lower income. When we think about Medicare and Medicaid, because we spend about 25% annually on insuring these individuals, and those costs are not going to go away anytime soon because of the baby boomer generation, it's important for us to be able to know that we have to have a backup plan. We can't necessarily count on these being available to us once we hit retirement age, which right now is about 67 to 68 years of age. We also need to look at the uninsured. The percentage of people without health insurance has been increasing in recent years, even with the inception of the Affordable Care Act. The percentage of uninsured is around 17%. One of the greatest problems caused by lack of insurance is that people delay or don't receive needed medical care because of the costs associated with it. When we look at race, class, gender, and healthcare, there are some overlaps. People of color across class lanes and low-income weights typically receive less preventative care and less management of chronic illnesses than other people. Wide health disparities exist across the lines of race, ethnicity, and class. Numerous researchers have found pervasive gender inequality in healthcare in the United States. 3 areas in which women's historical exclusion from medicine continues to have a detrimental impact on their health, and this includes underrepresentation of women in the medical profession, inadequate research on healthcare issues specifically pertaining to women, and women's differential access to medical treatment. While we have seen an improvement over the last decade, there still is gross improvement to be made. An increase in minority physicians is another pressing concern for medical schools and the practice of medicine now and in the future. Typically, minorities make up only about 6% of practicing physicians. There is still a white male-centered focus on some aspects of human health and healthcare delivery. When we look at this from both a medical school perspective and a medical practice perspective. Funding for research on minority and women's health issues and diseases is lacking, and some people of color and all women have been excluded from experimental drug trials. What we see here is an example of a pediatric dental care in which a young girl is receiving treatment. But something to be noted if you look at this is that this is a girl who is a minority, and this doctor is also a minority. Take a look at the seat that she's sitting on. It is a glorified bench for chairs, and it seems to be done in a setting that looks to be like the lobby of a dentist's office, not necessarily in the office itself. There is a stark difference in the medical, dental, vision, and prescription care for minorities versus whites. So how do we explain and find solutions for this problem? The functionalist perspective views illnesses as a threat to society because it's necessary for all people to fulfill their appropriate social roles in order to have a smooth, functioning social system. When people become ill, they cannot fulfill their everyday responsibilities and adopt the sick role. These are patterns of behavior expected from individuals who are ill. Sick people are not responsible for their incapacity. They are exempt from their role and task obligations. They must want to leave the role and get well, and they're obligated to seek and comply with the advice of a medical professional. Many problems in the delivery of U.S. health care are associated with macro-level changes such as the development of high-tech machines and medications, over-specialization of doctors, erosion of health insurance, and an increase in demand for health care. Hospitals often purchase expensive equipment that can be used only in specialized cases to meet increasing demands for high-tech medicine. Costs are passed on to the consumers. Individuals come to view healthcare as a right to which they are entitled. Some believe the healthcare system should be reorganized and national programs like the Affordable Care Act should continue to be implemented. Some feel that reforms now in the process of being implemented will fundamentally change nearly every aspect of healthcare, while creating even greater dysfunctions in an already overburdened and debt-ridden system. The conflict perspective is based on the assumption that problems in healthcare delivery are rooted in the capitalist economy, which views medicine as a commodity produced and sold by the medical industry complex. Although wealthy patients and those with good insurance may receive high-quality care, low-income and poverty-level people often do without quality care or any care at all. Physicians have benefited from the existing structure for many years because they've been able to charge inflated fees. Similarly, hospitals, clinics, and other medical facilities have been able to control how healthcare is delivered and what various costs will cost patients. Some conflict theories believe that problems in healthcare will be reduced in the United States only when large-scale race, class, and gender-based inequalities in this nation are adequately addressed and reduced. Most conflict theorists believe that, short of a dramatic change in the economic system, the primary way to deal with healthcare is to treat it as a common good that ought to be provided and regulated by the government, like highways, schools, courts, and national defense. That's essentially what the Affordable Care Act attempted to do, but there's areas of the Affordable Care Act that need to be reworked in order for it to truly be able to appeal to all races, classes, and genders. Symbolic interactionist perspectives believe that many problems pertaining to health and illness in our society are linked to social and cultural factors that influence how people define physical illness and mental illness. Medical and non-medical, quote, experts play a role in determining what constitutes physical and mental illnesses and how these illnesses should be treated by society. A specific problem results from a lack of communication between doctors and patients. Some physicians don't think it's necessary or possible to communicate certain types of information. There are a few ways to solve this communication problem. One way is to increase the number of family practice doctors, or primary care physicians, or PCPs. Another way is to emphasize prevention and work with patients on behaviors to practice and avoid if they want to stay healthy. A third way is to change healthcare and to limit bureaucracies in mental hospitals where individuals are labeled by their diagnoses and not viewed as people. Finally, symbolic interactions say more public health campaigns are needed to make people aware of issues in healthcare and healthcare reform, and perhaps those campaigns need to emphasize what it's like to be unable to afford necessary healthcare. We're seeing a lot of this now due to the current state of our politics. Some other solutions deal with disease management after a patient has been diagnosed with a chronic condition such as heart disease, diabetes, and cancer. Views on the doctor-patient relationship are faced with a different set of challenges today because of newer technologies. Similarly, many people receive medical information from the media and from the internet in lieu of going to their PCP. I hope that this was helpful for you. As always, if you have any questions, comments, or concerns, please feel free to reach out to me via email. Don't forget, in the description box below is your extra credit question. All you need to do is answer the question, take a screenshot, and upload it for extra credit. Remember, it's due by Sunday at 11:59 p.m. Until next time, I hope you have a great one and take care.